Many of us were shocked and saddened by the news of Kirstie Alley's death. She was recently diagnosed with colon cancer and was receiving treatment when she died. So what are the signs and symptoms of colon cancer? What should women know about the disease? Of course, to help us answer all those questions, we've got the one and only Dr. Kohli with us today. Okay, so Dr. Kohli, thank you for joining us. Talk to us. Why is colon cancer so deadly?
So deadly because if it gets picked up late, that's the difference between life and death. And especially in the last couple of years, guys, we've had a 40% decline in colon cancer diagnoses. And that's not because colon cancer is going away. It's because we haven't gotten our screenings. We're not picking it up. And we know that 1 out of 25 women will get colon cancer. So think about 25. Think about 25 women you know, one of them is going to get colon cancer. And only about a third of them are actually diagnosed in that early curable stage. And many of them are diagnosed once it's already spread past the colon, which means the survival just goes down.
Wow. So how often and at what age should women start to be screened for colon cancer, and how invasive is the screening?
You know, we've really been shifting that goalpost lower and lower because part of our modern diet, our modern lifestyle, we don't have as much fiber as we used to, not as much exercise, we're more sedentary. That's setting us up to now have colon cancer earlier than we used to decades ago when our ancestors were here. So basically we've now shifted it down to 45 from 50. So 45 is the first year an average person should get screened. That's coming up for all of us, so we have to keep that in mind. But if you have a family history or other risk factors, we actually even shift that screening down farther. And you know, it sounds kind of scary to get screened for any kind of cancer, but especially colon cancer, because they put a colonoscope, which is a camera, into the colon, and they look at it from the inside to see if there's any polyps, any tumors, or anything like that. But it's actually a minor procedure. It's outpatient. You go home the same day. You get to eat crackers and apple juice and watch TV
sign
all
me
day
up.
long. So it's actually not as bad as it sounds.
And it's way better than the alternative, which is finding out too late. Yeah, absolutely. All right, so let me ask you about this recent survey, Doc. 4 in 10 seniors think their physician doesn't care about them. And I grew up in hospitals, and I can totally see this. What's your advice to people watching, caregivers as well, when they feel that way?
Honestly, I was like shocked and saddened to hear the statistic, because one of the things that really engages us on a day-to-day basis, one of the reasons we put up with all the hassles of being doctors and dealing with insurance companies, is because we want to connect with our patients. To me, it's the ultimate privilege to be let into somebody's life, to change their life at a vulnerable moment. So 40% of my senior patients feel like they don't connect with me. That's, you know, something I need to work on. But the problem here is sometimes the environment that we function in limits our ability to be able to connect with our patients. So I think the first thing you have to ask yourself as a senior is, do you think it's the environment the doctor's practicing in or the doctor themselves? Because sometimes there's a personality mismatch, and you might want a male or a female or someone who has a different style, someone who gives it to you or someone who sugarcoats it, whatever you need. So that's the first question. And if it's the environment, then just be honest with your doctor. Tell them very nicely that, you know, you just need more of their attention or whatever it is you need from them. But do not, and let me say that again, do not just let it go unattended. Because if that's the case, what are you going to do? You're going to avoid that doctor. And that's when the disease happens.
So, Doc, I'm going to switch gears here a little bit. Marie Osmond, I'm not sure if you saw this, and I hate when celebrities do this, so maybe there's something to it. But she says she takes 1 tablespoon of mustard a day to keep her in tip-top shape while she's on the road. Is this ridiculous, like growing out 1 toenail and thinking it's good for your health?
Oh, God,
no. Who does that?
I haven't cut my big toe since 92.
Stop it right now.
Ew.
Oh my gosh, stop.
How do you think I got here? So seriously, is there anything to this?
So mustard, you know, is a low-calorie food. It's high in, it's called a superfood because it's high in potassium and calcium and a lot of good electrolytes and such. And there's some very small animal studies that say it may help with antioxidants, may help with blood sugar. But here's the big one.
Tori was already on her way to get some mustard.
So you can put a little mustard on your whatever French fries or whatever it is that you're eating, but squirting mustard into your mouth like that every single day is what's called supraphysiologic levels. It's too much mustard. So at that much mustard,
is that what that word means?
Can actually interfere with your thyroid function. It can cause inflammation in your gut. It can cause diarrhea and abdominal pain. So too much of a good thing, guys, is a bad thing.
You don't want to relish too much into it.
Oh, gosh.
I like that.
Now I want a hot dog.
That actually works really well.
God, you need to call Marie Osmond. Our executive producer knows her. You better tell her what Dr. Kohli just said.
Yeah.
All right, Dr. Kohli, thank you so much for being here, answering all of our questions. If you have a question for Dr. Kohli, write us, and also make sure to follow Dr. Kohli on Twitter at Payal Kohli MD, and we could read your question on air. Thanks again, Dr. Kohli. We'll be right back.